Hello everyone, this is Dr. Simone Atkinson again with another video working on a comprehensive review for the endocrine system to help you study for NCLEX using a question and answer format. So again, to save time and to make this accessible to you as soon as possible, you can use it while you're on the move, driving, etc. So I have used the AI reader to help read the questions and the answers to you. I want you to listen, identify things that you do not remember, and make notes of what you need to review in your textbook and restudy. Remember to smash that like button and subscribe to the channel. Let's get started.
Signs of hyperglycemia: polydipsia, polyuria, restlessness, confusion, blood glucose levels over 200, fatigue, and Kussmaul respirations. Glipizide. Drug class? Used for? Glipizide is an oral sulfonylurea drug used to control blood sugar levels in individuals with diabetes. Skin characteristic of Addison's disease? Hyperpigmentation of the skin is a characteristic feature of Addison's disease. When do you see the onset of type 1 diabetes? Type 1 diabetes typically begins in childhood. When do you see the onset of type 2 diabetes? Type 2 diabetes is often diagnosed after the age of 40. Symptoms of Addisonian crisis include? Symptoms of Addisonian crisis include a sudden drop in blood pressure, tachycardia, hypoglycemia, abdominal pain, and weakness. How do you treat Addisonian crisis? Addisonian crisis is treated by giving intravenous hydrocortisone. What is radioactive iodine used for? Radioactive iodine is used to destroy the thyroid gland in clients with hyperthyroid disorders such as Graves' disease. This leads to permanent hypothyroidism, requiring lifelong thyroid supplements. When is the use of radioactive iodine contraindicated? The use of radioactive iodine is contraindicated in pregnant clients, and all females should be tested for pregnancy before the procedure. What does a client with Marfan syndrome look like? Clients with Marfan syndrome are typically tall and thin. They may also have heart abnormalities, so contact sports are discouraged. What is radioactive iodine, RAI, used to treat? Radioactive iodine is used to treat hyperthyroidism by destroying the thyroid gland. Precautions for radioactivity, such as keeping the client in a private room, are necessary. Name some hypoglycemia symptoms. Symptoms of hypoglycemia include tremors, palpitations, anxiety, restlessness, sweating, and pallor. Which long-acting insulins can you not mix? Glargine and Detamir are long-acting insulins that should not be mixed. What does the peak mean when giving insulin? The peak of insulin refers to the time when the insulin is working most effectively to lower blood sugar levels. Rapid-acting insulin peak, aspart, Lispro, glulisine? Rapid-acting insulin peaks within 30 minutes to 3 hours after administration. Short-acting, regular, insulin peak? Short-acting, regular, insulin typically peaks within 2 to 5 hours. Intermediate-acting, NPH, insulin peak? Intermediate-acting, NPH, insulin usually peaks around 4 hours after administration. Long-acting, Detamir, Glargine? Long-acting insulins like Detamir and Glargine have no true peak. They provide a more consistent and prolonged effect. What is the ABG most consistent with diabetic ketoacidosis? The ABG, arterial blood gas, most consistent with diabetic ketoacidosis is metabolic acidosis. What is diabetic ketoacidosis? Diabetic ketoacidosis is a severe form of hyperglycemia characterized by blood glucose levels exceeding 250. It occurs when insulin is insufficient to remove glucose from the bloodstream, leading the body to break down fat stores into ketones. What is one golden sign of diabetic ketoacidosis related to breath? Kussmaul respirations, characterized by a fruity smell in the breath, are a key sign of diabetic ketoacidosis. After a thyroidectomy, there shouldn't be swelling of the neck or increased pain. What could this indicate? Swelling of the neck or increased pain after a thyroidectomy may indicate hematoma formation or increased tissue inflammation, which can affect airway patency and should be addressed promptly. What is hyperthyroidism? Hyperthyroidism is a condition characterized by an excess of thyroid hormones, T3 and T4, leading to an increased metabolic rate. Symptoms of hyperthyroidism include excessive sweating, weight loss without decreased appetite, anxiety, insomnia, palpitations, heat intolerance, goiter, enlarged thyroid, hypertension, hand/finger tremors, and protrusion of the eyeballs. What is hypothyroidism? Hypothyroidism is a condition characterized by a deficiency of thyroid hormones, low T3 and T4 levels, resulting in a decreased metabolic rate. Symptoms of hypothyroidism include bradycardia, dry skin, and weight gain. The elderly should avoid which type of diabetic drugs? The elderly should avoid sulfonylureas because they can cause prolonged hypoglycemia. What are the primary drugs to treat Addison's disease? The primary drugs to treat Addison's disease are corticosteroids. What is an important teaching point for long-term corticosteroid treatment? An important teaching point for long-term corticosteroid treatment is to never abruptly discontinue them, as it could lead to an Addisonian crisis. It's essential to report any signs of infection immediately because corticosteroid use can cause immunosuppression and even mask signs of infection. Clients should also watch for signs of hyperglycemia, and it's important to get an eye appointment every year due to the potential side effect of cataracts. Additionally, corticosteroids should never be taken on an empty stomach. If a diabetic client shows symptoms of hypoglycemia, what does the nurse do after checking the blood glucose? After checking the blood glucose and confirming hypoglycemia in a diabetic client, the nurse should provide them with a carbohydrate snack. Name some symptoms of hypoglycemia. Symptoms of hypoglycemia include sweating and pallor, irritability, tremors/weakness, tachycardia, drowsiness, and hunger. Severe hypoglycemia can lead to seizures and coma if the brain becomes glucose depleted. What is acromegaly, and what are the symptoms of acromegaly? Acromegaly is a condition characterized by the overproduction of growth hormone, resulting in the enlargement of the face, hands, feet, and various organs such as the tongue, spleen, kidney, and thyroid. Other symptoms of acromegaly include hypertension, heart failure, joint pain, skin changes, and hyperglycemia. What is the extreme thing that happens as a result of hypothyroidism? The extreme consequence of untreated hypothyroidism is myxedema coma, a severe condition characterized by lethargy, mental sluggishness, and may progress to a coma. What are some instructions for taking levothyroxine? When taking levothyroxine, it should be ingested on an empty stomach in the morning and separated from other medications. Blood tests are necessary to determine the accurate dose, and levothyroxine therapy is often lifelong. It's important not to take levothyroxine with antacids, iron supplements, or calcium. During a thyroidectomy, the parathyroid glands may be accidentally removed because they are very small in size. True or false? True, during a thyroidectomy, the parathyroid glands can be accidentally removed due to their small size. What is SIADH? SIAD stands for Syndrome of Inappropriate Antidiuretic Hormone Secretion. It occurs when too much ADH, antidiuretic hormone, is produced, leading to water retention, increased total body water, and dilutional hyponatremia. It can be caused by certain central nervous system disorders, and in some cases, lung cancer cells may secrete ADH inappropriately. Glucose levels should be watched when receiving a steroid, glucocorticoid. True or false? True, glucose levels should be monitored when receiving a steroid, such as a glucocorticoid. When a client is on prednisone, check glucose levels. True or false? True, when a client is on prednisone, it is essential to check their glucose levels. If a client is on digoxin, dig, monitor digoxin levels and also potassium levels. True or false? True, if a client is on digoxin, dig, both digoxin levels and potassium levels should be monitored. A client with SIAD is going to need fluid restrictions. True or false? True, a client with SIAD typically requires fluid restrictions to manage the condition. After a thyroidectomy, watch out for what? After a thyroidectomy, it is crucial to watch out for signs of respiratory distress, which can occur if the neck compresses the airway. Additionally, healthcare providers should be alert for stridor, a noisy breathing sound. Marfan syndrome needs to avoid what, and why? Marfan syndrome clients should avoid contact sports due to the potential risk of exacerbating their heart problems. Manifestations and symptoms of Graves' disease? Manifestations of Graves' disease include an enlarged thyroid gland and excessive thyroid hormone secretion, often leading to a bounding rapid pulse. What is an advantage of having an insulin pump? An advantage of using an insulin pump is that it helps maintain more stable blood sugar levels, reducing the fluctuations that can occur with multiple daily injections. However, it is still important for individuals with an insulin pump to regularly monitor their blood sugar levels. What happens in diabetic ketoacidosis? In diabetic ketoacidosis, the body breaks down fat for fuel due to the lack of insulin, resulting in the production of ketones. This leads to polyuria, rapid respirations, and potential life-threatening complications. What does radioactive iodine do for hyperthyroid issues? Radioactive iodine is used to treat hyperthyroidism by destroying the thyroid gland, which is overactive in this condition. If a female client is getting radioactive iodine to treat hyperthyroidism, what should you get for her? Before a female client receives radioactive iodine treatment for hyperthyroidism, a pregnancy test should be obtained to ensure she is not pregnant. After radioactive iodine treatment, RAI, clients will take supplemental iodine for life. True or false? True, after receiving radioactive iodine treatment, clients often need to take supplemental iodine for the rest of their lives. What is exophthalmos? Exophthalmos is a complication of hyperthyroidism, often associated with Graves' disease, characterized by the bulging of the eyes. It is essential to keep the eyes moist and protected in individuals with this condition. What is Addison's disease? Addison's disease is a medical condition where the adrenal glands do not produce enough steroids, including cortisol and aldosterone, leading to various symptoms and potential complications. Symptoms of Addison's disease include: Addison's disease is characterized by various symptoms, including hyperpigmentation, leading to the darkening of the skin, as well as weight loss, muscle weakness, low blood pressure, and hypoglycemia. What is hirsutism? Hirsutism is a condition that primarily affects women, causing the development of male patterns of hair growth on areas like the face, abdomen, chest, and back. It can be associated with conditions like Cushing's syndrome. Symptoms of hypothyroidism: everything is slow. Describe other symptoms to expect. Hypothyroidism indeed feels like everything is slow, but it also brings other common symptoms, including bradycardia, slow heart rate, weight gain, constipation, cold intolerance, dry and thick skin, cool and pale skin, brittle nails and hair loss, generalized edema, fatigue, anemia, muscle and joint pain, lethargy, forgetfulness, depression, decreased libido, and alterations in menstrual bleeding, which could be either reduced or increased. Hypothyroidism is said to cause lethargy and depression. So Synthroid, the hormone replacement, is supposed to cause elevated mood and more energy. True or false? True. Synthroid, a thyroid hormone replacement, is intended to improve mood and energy in individuals with hypothyroidism. However, it's important for clients to report any symptoms like a high heart rate, chest pain, or tremors, as these could indicate an excessive dose of hormone replacement, causing symptoms of hyperthyroidism. Levothyroxine takes about 8 weeks to see full therapeutic effect. True or false? True. Levothyroxine does indeed take around 8 weeks to achieve its full therapeutic effect in managing hypothyroidism. Why doesn't a client with diabetes receive dextrose solutions? Clients with diabetes do not receive dextrose solutions because they can raise blood glucose levels, which can be counterproductive in diabetes management. If someone is having a hypoglycemic reaction and their glucose is below 70, what is the first thing to do? The first thing to do when someone experiences a hypoglycemic reaction with glucose levels below 70 is to provide them with simple carbohydrates like orange juice or low-fat milk to quickly raise their blood sugar. What are the signs of a hypoglycemic reaction? Signs of a hypoglycemic reaction typically include low blood glucose levels, trembling or shaking, profuse sweating, and paleness. If a client can't ingest a simple oral carbohydrate, what are they given? If a client cannot ingest a simple oral carbohydrate, they may receive either dextrose or glucagon. However, it's important to be aware that these interventions can potentially lead to rebound hypoglycemia by stimulating more insulin release from the body in response to increased glucose levels. Describe diabetic ketoacidosis, DKA. Diabetic ketoacidosis, DKA, is characterized by several cardinal signs, including fruity-smelling breath and rapid, deep respirations known as Kussmaul respirations. DKA is typically associated with hyperglycemia, ketosis, and acidosis. It is more common in individuals with type 1 diabetes and is caused by an intense deficit of insulin. The treatment for DKA typically involves administering normal saline first, followed by 4 regular insulin and regular monitoring of fingerstick glucose levels. Thyroid replacement can give symptoms of hyperthyroidism like thyroid replacement therapy can sometimes lead to symptoms of hyperthyroidism, including diarrhea, weight loss, palpitations, rapid heartbeat, tachycardia, elevated heart rate, excessive sweating, and heat intolerance. These symptoms may indicate an excessive dose of thyroid replacement medication,